Now we have a doctor who has inquired about the provider tax, and the doctor indicates that he or she is concerned about the provider tax not being sunset this year, and thinks it should be sunset. Wouldn't mind if every provider service were taxed, but she thinks it's unfair to pick on one group of individuals, in this case medical providers, particularly when the tax is used for general fund purposes. Well, obviously there are lots of issues that are associated with the provider tax, and it includes, as we have discussed in previous weeks, the fact that it leaves a pretty significant hole in the budget. So that's an issue, and as I understand it, it's scheduled to sunset in the next year or two.
The end of this year.
End of this year. All right. Yeah. So should we start with you
Sure.
and see? Tell us where that's going and what you think might happen.
You know, healthcare is about over 30% of our budget right now, and also the fastest growing area of the budget. And as you mentioned, if that goes away, it's about $685 million that would be lost. And right now, and the viewer has a great point. In the past, and Democrats and Republicans alike would take money out of that fund and pay for other things. And initially it was set up to pay for Minnesota Care. And only $30 million of that $685 million now goes for Minnesota Care. Mainly kind of with the federal bill and so forth, change that. But the other amount, we've got $200 million right now that pays for the reinsurance program. And that was set up a couple years ago, and it really has stabilized that individual market. And that is set to click off also. But that's $200 million being funded by the Healthcare Access Fund right now in the provider tax. And then probably another $400 million close to it is reimbursement, Medicaid reimbursement rates. What I think we have to do as a legislature is, you know, it's got to be bipartisan somehow, is that we have to be very clear on how we're going to spend those dollars. I mean, we've got to tell the public it's going to go here, it's going to go here, and it's going to go here, and nothing else. And maybe if you get extra money into that, it goes into paying higher reimbursement rates or something. There has to be something that this is good for. And I don't care if it's called a tax or a fee or whatever, but we've got to do something to hold on to it. Because if it does go away, I think you're going to see huge uncompensated care in our hospitals. And you and I are going to pay for it anyway, either through increased insurance rates or increased hospital rates. And so I'm hoping we can bring the parties together. It's huge. If we lose it, I don't know how we pay for the reinsurance, that $200 million. How do we continue the reimbursement rates to hospitals and so forth? And I know it's kind of a long answer, but it's not an easy one. But somehow we got to work together and say, and maybe even retool it. But we've got to keep it. We can't let it run sunset.
So I think Representative Marquardt had it right. It also the expansion of Medicaid from 100 to 138%. We're paying for that. Those are working class Minnesotans that where they work doesn't offer them insurance that they either can afford or not at all. So we have to make sure that we talk about Minnesota Care and then the expansion of Medicaid, right, that has driven down, right, the unemployment rate or the uninsured rate in Minnesota. It also pays for healthcare economics. The Department of Health does some really, really good work on this issue. It also pays for the statewide health improvement that has started to tell us that how we exercise, how we eat. I heard Representative Marquardt said today he takes a run 2 or 3 times a week, right? I'm trying to eat just a little bit better, right? I don't know how well I'm doing with that, but we
you and I are both working on this project.
We're working on that, but it does really help. It also pays for reinsurance, and we're running a bill now on reinsurance which has kept insurance rates down. I don't know how sustainable that is. I'd rather do the Minnesota Care buy-in. That's my plug. But that being said, it is something that we need. It's $685, $700 million a year. So not only will potential uninsured rates in hospitals uncompensated care, but many of us care about education. So if you put a $1.5 million hole, this is the expert here, then something has to go. Either we're going to have to pour more money in the general fund, right, to figure out how to deal with that gap, or we're going to have to cut something along the way. And remember, the way that it works is it's set up in a way that if we repealed it, it's just a line through something that says sunset. This is a mechanism that is already in play. I will pitch that to the physician there, that the MMA, to their credit, has come in with a different proposal that gets us about $100 million less. It's collected a little bit different, and it kind of only works for people who live in Minnesota. So the hospitals, I won't name them, that do a lot of business outside of Minnesota may get a break on that issue, and I don't want to just call it out because there's a lot. But there is, especially in border cities like that. So there is a lot of conversation. I hope that we can get to that. In the Senate, it doesn't feel like we're ready for the conversation, but I know they are in the House.
President
Yeah.
Swazinski?
Well, that's, as we all ran races and hearing about some of the biggest issues facing families across the state is the cost of health care. And, $700 million in a provider tax portion is taxes that add to the cost of health care. It does get, at times, maybe used, filtered through government, and then sped back out into health care type programs. But at the end of the day, it does add to the cost of health care and delivering it across the state. It does have a sunset, and I would be more of the mind that we do allow it to go, allow health care to drop in price when it comes to that, and then make general fund decisions when it comes to the finance of our state. I mean, we have an administration that have made a lot of promises across the state. He ran on a thing of giving a lot of money to a lot of people. And when we're seeing revenues, I mean, we've got a $1.5 billion surplus now. It'll be interesting to see what that comes out to in the next week or two. And where that's going to be for our February forecast as we design the rest of the budget. But, I think it's going to be a real conversation and maybe a tough one as well, that maybe we can't do all things for all things. But I expect, particularly just from what I've heard from some doctors, nurses across our state, is healthcare and individuals and families and business owners, healthcare is a big cost and a big problem. And we need to not only get at the side of paying for it, but how do we actually get at the issues of how do we make it cheaper, more affordable, by still remaining and keeping the quality that we have, along with the research that we have here in the United States, and especially here in Minnesota. So,
We will have an opportunity to discuss that in greater detail. I think that issue is not going to get resolved in the short run.
No.